This is OGTV Comprehensive News. I am Tuji Akintayo, your main anchor for the news this evening. On the news, Nigeria confirms 4 new cases of COVID-19, now 44. Ogun State government bridges academic learning, commences Ogun Digi class. State revenue shrinks as FAAC shares 581 billion naira in February. COVID-19 global death toll climbs as Italy records 743 in a single day. 2020 Olympic Games delayed till 2021. Healthy citizens are the greatest asset any country can have. The Nigerian Center for Disease Control has confirmed 4 new cases of the coronavirus pandemic. The NCDC made this known via its Twitter handle on Tuesday. According to NCDC, 4 new cases of COVID-19 have been confirmed in Nigeria, 1 each in Lagos, Ogun, Bauchi, and FCT. 1 case is a returning traveler. The second case is a contact of a previously confirmed case, while the remaining 2 have travel history to Germany and the United Kingdom. As at 6:30 in the evening of March 24, there are 44 confirmed cases of COVID-19 in Nigeria, 2 discharged and 1 death. Meanwhile, a new case of COVID-19 has been confirmed in Ogun State. He is a 62-year-old male resident in Shagamu who recently returned from the United Kingdom. He is currently receiving treatment at the isolation center located in Olabisi Onabanjo University Teaching Hospital, Shagamu. Governor's Office correspondent Tunde Olaniran completes the story.
We have a newly confirmed case of COVID-19 in Ogun State. The said case is a 62-year-old male who resides in Shagamu, and they have history of recent travel, returning on the 17th of March. They presented with a history of cough and was tested, and the test has come back positive. Our priority at the moment is to provide care for the gentleman. He's being transferred to our isolation center, which is located at OUTH Shagamu.
The Commissioner for Health in Ogun State, Dr. Tomi Koka, says the contacts of the index person have been traced.
So he has recently returned from United Kingdom, and we've contact traced all his contacts, who are 28 healthcare giver and 4 members of his family, 32 altogether. We've been able to contact them. He's been very, very responsible by isolating himself since he arrived. Therefore, he's made our job quite easy in tracing his contacts.
She affirmed that the state government will distribute sanitizers, but warned that frequent hand washing is more effective.
We will distribute some hand sanitizer, but I must say the most effective way of preventing COVID is still hand washing with soap and water for 40 to 60 seconds. That's more effective even than the sanitizer. So people should wash their hands frequently.
Dr. Tomi Koka urged residents to remain calm and observe high level of personal hygiene. Tunde Olaniran, OGTV News.
The Chief of Staff to the President, Abba Kyari, has reportedly tested positive for COVID-19. However, President Muhammadu Buhari had tested negative, but he will be tested again in a few days. The State House has yet to comment on either Buhari or Kyari's coronavirus status. Kyari is one of the oldest persons in Nigeria with a confirmed case of the novel coronavirus. Meanwhile, 3 officials in the office of the Chief of Staff to the President have reportedly tested positive to the novel coronavirus. A presidential source confirmed the development. In the meantime, all persons suspected to have been exposed to the Chief of Staff to the President have been advised to be in self-isolation. Bauchi State Governor Bala Mohammed has tested positive for coronavirus. The Senior Special Assistant to the Governor on Media, Mukhtar Gidado, disclosed this in a media statement made available on Tuesday. The Governor earlier said he met and shook hands with Mohammed, the son of former Vice President of Nigeria, Atiku Abubakar, who tested positive for COVID-19 on Sunday. The governor had been on self-isolation since Monday. To keep pupils and students of both primary and secondary schools in Ogun State abreast of their academic works, the state government has created a platform for the teaching of mathematics and English language. This is in response to the recent ban of high-density gathering due to the COVID-19 virus, which also led to lockdown of public and private schools across the state. Tagged Ogun DigiClass, the initiative, according to the special advisor to the governor on primary, secondary, and technical education, Mrs. Ronke Shoyombo, is to further ensure that learners are still undergoing the learning process while on the unplanned impromptu academic recess. The statement by the Chief Press Secretary to the Governor, Kunle Shomori, adds that top-notch educators who would handle core topics in the two subjects have been assembled for the Ogun DigiClass initiative. The visual learning will run on Ogun State Television via channel 26 on DSTV, 100 on GoTV, 113 on StarTimes, as well as on its terrestrial platform, channel 25 UHF. Time of the streaming are 9 to 11 in the morning classes for primary school and 1 to 2 in the afternoon for secondary schools. However, students who may not have the opportunity to be part of the televised sessions could also visit www.ogundigiclass.ng to watch the recorded version of the classes. In addition, students can also send questions on any subject on the platform while the teachers assist them. Following the present coronavirus epidemic rampaging almost all the nations of the world, it is pertinent to further broaden the various sensitization program of Ogun State government aimed at enlightening the general public on the need to imbibe personal hygiene. To this end, all farmers and animal health workers and butchers are hereby advised to adhere to hand hygiene, respiratory hygiene, and social distancing as preventive measures against the spread of the disease. In a statement signed by the Honorable Commissioner for Agriculture, Dr. Adeola Odedino, cattle dealers and abattoirs across the state are especially advised to avoid overcrowded areas, practice proper hygiene by washing their hands with soap and water, and make use of sanitizers as necessary. In addition, it is advisable to also stop blowing noses with bare hands, but rather use disposable tissue or the flex elbow. For more information, people can contact the following numbers: 081 88 978 393, 081 889 78392. Lagos State Governor Babajide Sanwo-Olu has ordered the closure of markets, stores in the state with effect from Thursday. According to him, markets that sell essential commodities such as equipment, medical equipment, water, foodstuffs are exempted. The governor, in a press conference on Tuesday, said it is not a total lockdown, but trying to decentralize markets in Lagos. He said government closed schools and markets so that people can buy food and medicine without going a long distance. The Senate has adjourned for 2 weeks to reconvene on the 7th of April as a preventive measure against the spread of COVID-19. Both chambers of the National Assembly had last week restricted visitors from entering the premises of the National Assembly, with the Senate suspending all public hearings. The Senate reconvened for Tuesday's plenary amidst paparazzi tension created by the rampaging COVID-19. It immediately dissolved into a closed-door session which lasted 2 hours, after which the President of the Senate, Ahmed Lawan, reports on the outcome of the executive session.
John sitting for 2 weeks from today due to the pandemic of coronavirus ravaging the entire world. Federal government should give financial and other resource assistance to the states in the fight against the virus.
The atmosphere in the Senate became sober when the majority leader announced the death of the senator representing Cross River North Senatorial District, Senator Rose Oko, who died in the United Kingdom.
On trade and investment.
As the Senate Press Corps Chairman, Senate Committee on Health, Ibrahim Olori-Egbe announced that no senator has tested positive to the COVID-19 virus.
I must tell you that there's no senator that has tested positive, as far as my knowledge is concerned, as at this morning.
Yes, we have agencies of government in the various airports, and none of these agencies of government have complained to the Senate that so-so and so-so have refused to follow the due process.
At the moment, no senator has exhibited symptoms of the virus. You're watching OGTV News. In the part 2 of the bulletin, 21,600 Nigerians unaccounted for in 2019. More news and reports after this break. You're welcome back. Tuberculosis is caused by bacteria that can be spread from one person to another through the air. Every 24th of March, World Tuberculosis Day is celebrated to raise public awareness about the devastating health, social, and economic consequences of tuberculosis and to step up efforts to end the global tuberculosis epidemic. In 2018, 87% of new tuberculosis cases occurred in the 30 high tuberculosis burden countries, which accounted for 2/3 of the new tuberculosis cases in India, China, Indonesia, Philippines, Pakistan, Nigeria, and South Africa, among others. While speaking with the State Manager for Control of Tuberculosis, Ministry of Health, Dr. Esther Oguntayo, who says people with active tuberculosis can infect 5 to 15 other people through close contact.
When you are in a crowded, when you should avoid overcrowding, that's number one. Then you should have adequate nutrition, taking balanced diet, good that are rich in protein, rich in minerals, vitamins, and carbohydrates, good that are rich, that are balanced. Then apart from that, in as much as possible, let's make sure that we ensure cough etiquette. What do I mean by cough etiquette? When you want to cough, you cough into your elbow. And if you have to cough into you cough into an handkerchief or a tissue paper.
So Guntayo also reflects that when people with lung tuberculosis cough, sneeze, or spit, they propel the tuberculosis germs into the air.
Everybody is at risk of tuberculosis because tuberculosis is an airborne disease. And once a person infected with tuberculosis coughs into the air, then anybody that breathes in such air is at risk of developing tuberculosis. And everybody, if anybody infected with tuberculosis can infect 10 to 15 people if untreated annually.
The Department of Tuberculosis Control and the State Ministry of Health stated that suspected cases of tuberculosis should call this number 080-02-255-282 for free diagnosis and treatment to ensure the infectious disease reduced drastically. Meanwhile, the wife of Ogun State Governor, Mrs. Bamidele Abiodun, has joined the League of Individuals and Group in canvassing a drastic reduction of tuberculosis among Nigerians. In a message marking this year's World Tuberculosis Day with the theme, "It's Time," Mrs. Abiodun called on health workers, religious leaders, members of the civil society organizations, as well as media organizations and practitioners to support government's efforts in eradicating tuberculosis. Mrs. Abiodun said the challenge before all is to innovatively increase case finding from the current 3,102 in 2019 to about 12,000 estimated for the state. The statement therefore encouraged members of the community to let anyone with symptoms to visit the facilities for free tests and free drugs for treatment, and those on medication to finish their drugs. Ogun State government, the statement noted, has continued to adopt several innovative approaches to increase access to quality tuberculosis prevention and treatment through effective engagement of more public facilities and collaboration with private sectors. Mrs. Abiodun in the statement said tuberculosis services have been extended from 216 DOT sites in 2018 to 306 in 2020 across the 20 local government areas. The International Committee of the Red Cross says no fewer than 21,600 Nigerians got missing in 2019. The ICRC Communication Field Officer in charge of Port Harcourt delegation, Mrs. Sophia Uduma, made the revelation in Enugu during a press conference. Uduma said majority of the persons got missing during violence or communal wars, which according to her is prevalent in the northern part of Nigeria. The communication officer noted that the cases of persons reported missing were being handled by the ICRC in collaboration with the Nigerian Red Cross Society. Request of Ogun State Governor Prince Dapo Abiodun on restricting and refinancing the various loans in the debt stock of the state has received the approval of the State House of Assembly. The approval was considered after the request was deliberated upon by lawmakers at a plenary held at the Assembly Complex, Okemoson, Abeokuta. House of Assembly correspondent Kolawole Osho covered the plenary, and his report is presented in this package.
The Speaker, Right Honorable Olakunle Oluomo, at the plenary acknowledged the Governor's correspondence dated 17th of March 2020, seeking for restructured term loans of over 74 billion naira obtained in 2015 and infrastructural loans of over 35 billion naira obtained in 2017 by the last administration in the state.
The Honorable House is kindly requested to issue a resolution to enable the state government to finance the unlisted facilities in our debt stock. The structured term loan MTN bond of 55 billion, 405 million, 175,055 naira 11 obtained in the year 2015. Special socio-economic development intervention loan of 20 billion naira obtained in 2017.
The motion for the approval of the Governor's request was moved by the Majority Leader, Honorable Yusuf Sharif, seconded by Honorable Kemi Oduwole, and supported by the whole House through a voice vote. Lawmakers who contributed to the debate, which led to the passage of the motion, explained that the approval became imperative in order to meet the shortfall in the price of crude oil at the international market, which has impacted negatively on the global economy, thereby resulting in revenue downturn of government at all levels. Right Honorable Oluomo, in his remarks, commends the robust contributions of the lawmakers, adding that increasing the tenor of the facilities would definitely reduce the monthly debt service and making more funds available for project implementations.
Approval is granted to the state government to refinance and restructure the unlisted facilities in the state debt stock.
In other development, Speaker Oluomo has directed the State Commissioner for Forestry, Mr. Tunji Akiosi, to appear before the State House of Assembly's Committee on Justice, Ethics and Public Petitions on Monday, the 30th of March 2020 at 10 in the morning.
In its determination to further promote a healthy environment and be the cleanest state in Nigeria, the Ogun State government has instituted a yearly Best Local Government Sanitation Performance Award among its 20 local government councils in the state. Special advisor to the Governor on Environment and head of the State Waste Management Authority, Mr. Ola Oresonya, who revealed this when he paid a sanitation advocacy visit to Abeokuta South and Odeda local government areas, said The local government will soon impanel a committee to assess the local councils for the award. He says as part of the Key Performance Index, local governments must enact their own environmental bylaw, which will empower them to inspect houses, markets, and other public places for sanitation compliance and infraction, adding that the old law is obsolete and inadequate for the present situation.
The key things the government is doing, as the chairman was briefed with his colleague, is the major reform in waste management, and especially the sanitation component, which is the public waste strategy. Before now, the standard was to allow people to bring waste to the road, and you have government officials and contractors come to the road to pick the refuse on the road. We have to reverse it.
Mr. Oresonya also wants the local government authorities to see waste management as disease control strategy, as all houses in their local council areas must have covered waste bins in their frontage for easy collection by waste managers assigned to their wards, while community waste recycling plants will be sited in each of the 20 local governments to provide employment for women and youths. Activities of nurses in various hospitals the world over in ensuring the safety of patients through safe medication, control of symptoms, and managing disease among other workload cannot be overemphasized. The appreciable standard of nurses, however, cannot but face some unethical services, as the profession is believed to have been infiltrated by those that are not qualified for healthcare services. In this report, Peter Falomo sought opinions of medical personnel on the position of auxiliary nurses and healthcare practices. His report.
It is no gainsaying that nurses in government or privately owned hospitals engage in active participation of clinical services.
We are multifaceted, we are dynamic, we are in almost every areas of life where care is being given. Like we have orthopedic nurses, we have ophthalmic nurses, we have theater nurses, perioperative nurses, we have anesthetic nurses, we have so many, all areas.
According to respondents, allowing the training of auxiliary nurses, otherwise referred to as quacks, and allowing them to practice is against the ethics that guides the nursing profession.
They can have the idea of the job, but the scientific principle surrounding the work they are doing, they don't know. They want to give an injection, they know quite well, especially when it comes to maternity and delivery. They know that at a stage in labor, you can give pitocin. They don't know the amount, but the scientific principle of what they are doing, they don't know.
Others share their experience, and those who came in contact with squawks on the administration of medication.
Most of them are even having a pharmacy store. When you go there and say want to buy something, they are the ones that kill people when they have to go and be buying fake drugs. I don't want government to allow them to work at all. Let them go to school.
You can't compare someone that that has or had a bachelor degree in nursing with someone that just went to maybe a roadside clinic. I've seen a lot in the society, a lot of clinics, and then young girls, you know, going for nursing training, you know, not like in an educational institution. The certificate, the training is very, very essential.
Personnel in the nursing profession enjoin the government to ensure that health havoc being perpetrated by the quacks is nipped in the bud.
We are in the era of evidence-based nursing, whereby I give you reason for giving you a particular care. I want you to know that I am tepesponging you because you have temperature, you know. That kind of enlightenment has been done in so many of our markets.
Government is trying as much as possible because as far as Ogun State is concerned, we have the Department of Monitoring in the Ministry of Health that goes around town to certify hospital and see the group of staff that are working there before they give them the authority to practice.
They submitted that most people who parade themselves as nurses in the country without license to operate are cheaper to employ and could be relieved of the jobs when least expected. Peter Falomo, OGTV News.
Troops of the land, air, and sea components of Operation Lafayette Dole have said 4 multinational joint task force have killed 54 and captured 4 Boko Haram terrorists within the last 7 days. The coordinator, Defense Major Operations, Major General John Owenche, stated this in Abuja while providing a periodic update on ongoing joint operations of the armed forces and other security agencies. The coordinator noted that 48 of the terrorists were killed by troops of Sector 4 Operation Lafayette Dole in an encounter in Tumu, Niger Republic.
With the facilities to quarantine and then to eventually treat. So, and then as a backup, like we are heading in other countries to enforce, if there is going to be a lockdown, yes, we have the resources to ensure that the lockdown is effective if it comes up.
Major General John Owenche noted that the land, air, and sea component of Operation Lafayette Dole and Sector 4 Multinational Joint Task Force have eliminated 54 and captured 4 Boko Haram members within the last 7 days.
Multinational Joint Task Force also successfully repelled a Boko Haram terrorist attack at Tumo in the Republic of Niger. During the attack, 48 terrorists were invalidated, that is killed, while 4 others were captured alive by the troops.
Defense headquarters stressed that the operations were intelligence-driven and appealed for timely and accurate information for the public. Still to come in the business segment of the news, coronavirus takes toll on Nigeria's revenue generation as federal allocation for states shrinks. More details in the business segment of the news. Welcome to the business segment of the news. The Federation Account Allocation Committee has shared the sum of 581.56 billion naira to the 3 tiers of government for the month of February. The February allocation represents a decline of 65.79 billion naira when compared to the 647.35 billion naira which was shared in the month of January. The distribution was made at the end of the rescheduled meeting which was held at the headquarters of the Ministry of Finance. The meeting had last week ended in a deadlock following disagreements about how much was presented for distribution to the 3 tiers of government. The 581.56 billion naira was made up of statutory revenue of 466.05 billion naira, value-added tax of 99.55 billion naira, exchange gains 757 million naira, and revenue from forex equalization account 15.19 billion naira. No fewer than 80 countries are seeking the intervention of the International Monetary Fund, IMF, to combat the effect of COVID-19 on their economies. This was revealed by Kristalina Georgieva, IMF Managing Director, at a G20 finance ministers and central bank governors call on the coronavirus emergency. Georgieva, who called for cooperation among countries to defeat the rampaging disease, said the human costs of the coronavirus pandemic are already immeasurable and all countries need to work together to protect people and limit the economic damage. To her, this is a moment for solidarity as the outlook for global growth for the current year 2020 was negative, adding that a recession as bad as that of 2007 to 2008 was imminent. That was the business segment of the news. We'll be back after this time out. Welcome to the World Today. On the World Today, Italy reports 602 new coronavirus deaths in the last 24 hours. In India, 1.3 billion people will undergo total lockdown from midnight on Tuesday for 21 days to combat the spread of coronavirus. Let's now join Olayinka Shodunke for details.
On the World Today, we continue our coverage on the coronavirus as it continues to spread across the globe. In India, 1.3 billion people will go under total lockdown for 21 days to combat the spread of the coronavirus pandemic. The Prime Minister said, warning that anyone going outside risked inviting the virus into their homes and pledging $2 billion to bolster the country's beleaguered healthcare system. From 12 midnight today, Tuesday, the entire country will be in lockdown, total lockdown. Modi said on Tuesday in a televised address a second in a week. India has lagged behind other nations in the number of COVID-19 cases, but there has been a sharp increase in recent days to 519 infections, including 10 deaths, according to the government. Italy has reported 602 new deaths from the coronavirus on Monday, bringing the total to 6,077, with the tally of cases in the country, a major hotspot, raising to 63,928. The number of reported deaths in the country dropped for a second day in a row after, on Saturday, reaching an all-time high since the outbreak began of 793. In the UK, the number of those who have died from the virus increased by 54, bringing the total in the country to 335 among 6,650 cases. Meanwhile, Prime Minister Boris Johnson ordered residents across the country to stay at home. In Spain, the coronavirus death toll has jumped by 514 in a single day as the situation in the country quickly worsens. Official figures show that 2,696 people have now died in the country and close to 40,000 are infected. About 5,400 healthcare workers are among those confirmed cases. Spain is the worst affected country in Europe after Italy, which has recorded more than 6,000 deaths so far. In China, the lockdown in Wuhan, the city where the global coronavirus outbreak began, will be partially lifted on the 8th of April. Travel restrictions in the rest of Hubei province, where Wuhan is located, will be lifted from midnight on Tuesday for residents who are healthy. A single new case of the virus was reported in Wuhan on Tuesday, following almost a week of no reported new cases. And that's it on The World Today.
Sadly, the death toll in Italy coronavirus cases have risen to 743. That was The World Today. Up next is the sports segment after this time out.